Call the meeting to order. Agenda review and disposition. Any changes?
If you can add negotiations into non-public, please.
Okay, negotiation, let's add it. All right, privilege of the floor. Does anyone want to speak before we start the meeting?
Is this for public comment?
Yes.
Yes, we would go. I have some remarks.
Okay, so if you want to step on up and just say your name and your residency and then begin.
Sure. My name is Martha Favors. I live here in Plymouth. I have my remarks typed out, just I wanted to make sure I covered everything. So I'm here as a parent of an 11th grader here at Plymouth Regional High School. I also just, have an 8th grader at Plymouth Elementary, and like every parent, I think I spent the last 20 months, most of my time has been occupied with trying to understand the impact of COVID-19 and determining the best way to navigate all of this for me and my family. And last fall, when students were returning to SAU 48 face-to-face, I have to admit I was really concerned, and two facts really helped mitigate those concerns for me. And first was the data, which is that we did have relatively low rate of the disease in our community last fall, and second was the policy, which really was about SAU 48's commitment to requiring masks in the school. And then a third fact that I would say emerged during the year that really brought me a lot of comfort was the emergence and availability of the 3 vaccines for 16 and over and then 12 and over before the school year was even started. So I want to thank all of you for your hard work last year. There were a few things that I think you just did really, really well. I can't emphasize enough the peace of mind it gave the parents knowing that masks were required in the schools. And while I was worried about distancing and the spread of the disease with students in close contact, knowing that that was a requirement was a huge comfort. And secondly, I'm very appreciative that the schools made vaccination clinics available to students during school hours. While not every student probably took advantage of that, I feel like it was an important message for the schools to send that the vaccines were available and effective and important for stopping the spread of the disease in our community. So like most people, I think probably in this room, I started the summer with a great deal of hope that we were reaching a turning point. Our vaccination rates in New Hampshire were pretty strong compared to the rest of the country. Our case numbers went down significantly, as we all know, in June and early July. So it's been really concerning and disheartening to watch as the disease has resurged in large parts of our country, leading to exploding case rates, swamped hospitals, and another wave of deaths. And most concerning has been to witness the Delta variant and how it's driven this surge. And early data that seems to suggest Delta may be far more contagious than the original virus, and that maybe young people are more likely to contact and spread it. As this school year loomed, I was anxiously waiting to hear from the SAU how we would be handling COVID and what this new normal would look like. And I have to be honest that 2 facts about the plan have left me feeling as a parent worried and disheartened. First, that nowhere in the plan did I see mention of making use of SAS, the Safer at School screening program offered by New Hampshire DHHS to all schools across the state. I'm sure that you all know it's designed to test willing asymptomatic individuals once a month, those who have not been vaccinated. It's not required, it doesn't mandate testing, and it's not a substitute for those who are symptomatic from going out and getting a PCR test to rule out COVID. But it is funded entirely through a grant from the federal government. And I know that this kind of surveillance testing is most effective in localities that are experiencing substantial spread, which we are not right now in Plymouth. So I'm aware that with those relatively low numbers, this might not be the best moment to be implementing SAS. But that said, as a PSU employee, I was part of the regular testing all last year, weekly and then bi-weekly in the spring semester. And I know that within a very short amount of time, a population can go from minimal spread to substantial cases. Last year at the university, we jumped from single-digit cases to 104 cases in one day. And that was literally overnight for our community. And it drove the case rate across our county, having that happen here and then at Dartmouth. And this was all prior to the spread of Delta. So I would just like to strongly ask you, encourage you to take advantage of the SAS program by reviewing it and putting a plan in place to immediately implement it if we do see case numbers rise in Plymouth. I know it does not solve the problem, but it is one tool that is available to us. And I would love it if the board would determine if it would be useful and then clearly communicate to parents and the larger community the threshold that would warrant implementing such a program. The second piece of the plan that has been discouraging has been the huge change to masking policy this year, with guidelines outlining usage that ranges from optional to strongly recommended, depending upon community transmission and observed clusters in our schools. The SAU guidelines state that only local school boards may exceed the guidelines and require face coverings, but they do not identify criteria or a threshold for considering such a change. Published guidelines for the start of the year stated that masks were merely recommended when individuals couldn't maintain 6 feet of distance. I will tell you, this past week I spoke with my own children at this school and at PES, and their observed mask usage is very low. I think they would probably put it at 20 to 30% of students and staff. Conversations with other parents that I've had over the last few days in the SAU have revealed similar numbers. And on Friday, I know Superintendent Welsh sent out an update that beginning today, usage would be recommended when individuals are unable to maintain more than 3 feet. As with the original school guidelines, though, that statement included this sentence: although we are recommending masking, it is important to remind everyone that it is a parent's choice as to whether or not a student wears a mask. I find this caveat concerning in that it signals clearly that masking, which is absolutely one of the most vital public health measures for preventing the spread of COVID, is a simple choice with no obligation to a public good. There have been numerous studies about the efficacy of masks to stop or slow the prevention of COVID, and as it turns out, it's actually difficult to test that impact. Studies looking at masks used in real-world situations suffer from confounding factors. The type of masks people use, how well they fit, how vigilant people are about wearing them, the impact of mixed masked versus unmasked encounters, the interplay between masking and social distancing and other public health measures. On the other hand, lab-based studies tend to look at ideal circumstances that are not reflective of real-world situations. And I understand that this makes it very difficult to discern the actual impact of masks in our schools and classrooms. That said, I believe that in the absence of clear negative impacts of masks and in the presence of at least some data that suggests masks are beneficial, it makes sense to require masks whenever possible. And there is evidence that masks work. I mean, since the mid-20th century, medical professionals have used surgical masks as a tool to prevent the spread of disease within healthcare settings. In certain countries, wearing masks due to pollution or during flu season was already commonplace before the pandemic, and studies had already shown they provided protection against disease. And perhaps most important for our community during COVID, several studies have shown a correlation between mask wearing in schools and lower rates of community spread of the virus. The American Academy of Pediatrics recommends everyone over 2 wear masks in school settings to slow the spread of COVID. And here in our community, Plymouth State began the semester with a mask requirement that has now been extended to October 1st as of this evening, for at least the first, to see what happens as we welcome students back to campus. But the most important precedent, I believe, is our own. Last year, SAU 48 mandated masks, and by your own reports, did a good job of controlling COVID within our schools. I would argue that that was in large part due to that mask mandate. Meanwhile, there really are no reputable studies showing that masks are detrimental to health. The American Disability Association, in fact, recognizes that mask wearing is an important public health measure, particularly for those with disabilities. And while they require states and local governments and small businesses to provide reasonable modifications to services, they do not allow granting exemptions or exceptions for required mask use. Last year, the SAO was able to offer students an in-person experience for which I am so grateful, while students, faculty, and staff remained masked. And again, I believe this because we were able to do this successfully because of that requirement. Removing it this year, as students under 12 remain unvaccinated and Delta surges around the country, seems to be ignoring all the evidence at our disposal and the lessons from our own past success. The state of New Hampshire has clearly left the management of local COVID responses to you, the local SAU leadership. There's nothing preventing you from requiring masks. In fact, as I said, your own guidelines offer no threshold which must be considered before making such a change, or implementing the SAS program. One of the core beliefs of the PBRSB Back to School plan for fall of 2020 was student, staff, and community safety will be our highest priority guiding every decision. And as a parent, those words gave me hope last fall. I can only assume that that core belief has not changed in the last 12 months, and I'm here to ask you now, how does making masks optional and refusing state-provided testing protect the safety and health of students, staff, and our community? Please listen to my voice and the voices of other SAU parents who care deeply about public health. Please consider required masks and offering these tests.
Thank you, Martha. Does anyone have any clarification questions or any kind of questions for Martha?
I have a question.
Sure, Maureen?
Yeah, the American Academy of Pediatrics, with their recommendation, was that with high community spread or a certain level of community spread, do you remember?
I will be honest with you that I looked up a bunch of stuff today, and I don't remember off the top of my head whether or not they had a caveat to that.
Okay.
But my understanding is that it is just 2 and over in school settings at this point. And Heather Mason is nodding, and she would know better than me.
Great, anyone else? Okay, anyone else wish to speak?
I'll speak. Hi, my name's Heather Mason. I have a senior here at the school. That's all I had to say.
Right, that's good. That's perfect.
I would just like to say that I agree with everything Martha just said and just add a little bit more, in particular about the SAS program. It is a program that you can sign up for and you can decide whether you want to use it routinely or not. The benefit in signing up for it now is that if you did have a cluster or some sort of outbreak within your school, you would be able to utilize that unit. They would come in. It is totally third party. It's not going to inconvenience any teachers, any administrators, even the school nurses aren't really involved. They come in and do all of the testing themselves. And it, like I said, it is a way to figure out if you have a cluster or an outbreak before it spreads even further. So that's the SAS program. I also didn't know if you guys were aware, you probably are, that the Department of Public Health has also put out a school and child care toolkit for schools. And it's very, of course, they're only recommending, they're not requiring things. However, as far as masks go, there is a universal masking should be used if there's substantial transmission within the community, actually within your county, which all of our counties are now at substantial transmission. If there's a single cluster in school, or if there are multiple clusters, obviously, or outbreaks. If you listen to Dr. Chan's phone calls, which I'm sure some of you do, you can tell that, yes, these are recommendations, but the way to stop COVID from spreading is, one of the ways to stop COVID from spreading is to wear masks. And it is also very disappointing to me that not only are you not requiring it, but you're putting out a message that says that we are strongly recommending masking, but you still have the option. Like, I just don't even understand why that line has to be in there. But I would really encourage that everybody on the board knows about this school kit, and everybody should know about the SAS program, and I would really encourage you to sign up for the SAS program moving forward.
Thank you, Heather. Does anyone have any questions for Heather? Okay. Okay, thank you, ladies. Any other privilege of the floor? Any other? Sarah? No?
I think my statement
Sure.
was last time, in that if you feel like masks are important enough to recommend, the only way to change the behavior is to require it. And we can see that in the high school when we talk to our kids and we look in the high school and we see 10 to 20% of the people wearing masks. A recommendation isn't effective, especially at this age. And so if you feel it's important, then I would love for you to make it a recommendation, a requirement.
Thank you, Sarah.
Thanks.
Okay, all right, so we're at approval of minutes. Approval of minutes from August 10th, 2021. Do I hear a motion? Or I guess I should say any corrections or any modifications to those minutes?
I was going to make a recommendation.
Okay, so Barbara made a motion, seconded by?
I'll second.
Seconded by Roger. All those in favor?
Aye.
Opposed or abstaining?
Abstain.
Abstaining.
Abstaining.
Okay, thank you. Maureen and Tim. Okay, great, thank you, everyone. And principal's report.
Thank you, Madam Chair. Welcome, Paul
I was
Pisano.
just going to say welcome, Walter, too.
And representative from Ashland. Paul, thank you very much.
I say welcome, Paul.
Before I turn my part of the portion over to Dr. Kylie Kapp, who's to my right, is going to report out on the workshops we did with the teachers, both with curriculum and the PLCs that she was responsible for. We're briefly, too, going to talk about, we're starting up the school community council. That needs to be added to our agenda as one of our subcommittee reports. And Kylie will have nominations tonight for Thornton, and we'll be looking for representatives from the other sending towns in the near future. And the topics that are discussed from the SEC, they'll be brought here to you for your proposal. But Kylie will be heading that up. So if you wouldn't mind, could you just briefly introduce yourself to Dr. Kapp, who'll be attending these meetings with me in the future? Christy?
Oh, sorry. Christy, there was the phone.
Tim Miller. From Colburn. Walter Joyce Thornton. Roger Starkins, Romney. Peter Pettengill, Campton. Paul Pisano, Ashland.
Lisa Ashcampton.
Amy Sullivan, Wadsworth.
Maureen Everett Fleming.
I'll second. Yep, Barbara Noyes. Kylie?
I had some great training at the end of the year, as well attended by teachers. They were very eager to learn about understanding by design for some curriculum work. We're going to be doing a lot of curriculum work this year. And we also did some PLC training in August for 3 days. And again, we had really good participation from teachers. So I'm excited about moving forward with that. We'll be doing a lot of PLC work and curriculum work during faculty meetings, during department meetings, during in-service. It's going to be our main focus for the year. So I'm looking forward to that. We did want to talk about SEC. We do need a couple town reps we need one from Ashland, one from Holderness, one from Rumney, one from Wentworth, and one from Waterville. So if anyone's interested, please reach out. You can reach out to myself, or you can reach out to Mr. Parsons, and we'll get some representatives for that. The other thing, do we want to talk about digital portfolios?
Yeah, please do.
The other thing I want to is talk about digital portfolios. It's been a requirement by the state, but you can actually now have a half credit of computer, and that qualifies. You don't have to do a digital portfolio. Majority of our classes cover that credit. It doesn't have to just be a specific computer class. All of our CTE, all of our arts, a lot of our classes cover that. So the majority of all of the students will have a class that covers that by the time they graduate. We have within the 4 years. So we would like to not have to, require that for graduation anymore.
You would make the senior class very, very happy. Which I kind of like overstepped and told them on Thursday that I was proposing this to you people. They were yelling my name in chants that night. A good thing. So, but that has been coming down from the state from a long time. So that will help us with graduation, because I've always had to chase those poor kids around in April for that. So that's a good piece. Let me fill you in on the opening of school. We had a great week. The kids were very enthusiastic. The buses, we're down one bus, but the numbers, they did not scare me. Ashland Holderness was at 20. Reservoir Road, that's a small bus, was at 7. Campton Thornton Route 3 was 32. Campton Thornton 175 was at 29, and I pretty much did this every day. The Rumney Wentworth bus was 22. Holderness has a small piece that was 7, and the fairgrounds run was 11 kids, and that was the constant piece throughout the whole week. But we didn't have any problems with the buses. Timing was a little off, but they got their act together. And I apologize to the sending towns, the elementary schools. Yeah, Bruce did hold the buses up for the first week. Keep in mind, the freshmen trying to find their buses could be a terrifying experience. So I did hold the buses an extra 4 or 5 minutes. I got a call today from a principal and said, "Bruce, is it true that you held up all the buses?" I said, "Yeah, for about 5 minutes, but that wasn't too bad." They got off on time today, and they leave at 2:20. Numbers were staggering. 9th grade came in at 192. That's a lot of kids. That's one of my biggest freshman classes that I've had in my years here. 10th grade, 161. The 11th grade, 142. And the 12th grade is 143 for a whopping 638. I only had 17 students that were VLAX or homeschooled. That number will grow just a bit. As this week, it settles in, and I've been tracking some students that claim they're going to be at VLAX, and I will follow through at the end of the week to make sure they're either at VLAX or they're with a school. We did have approximately 92 students come and go. So say 45 left and I got 45 new ones. And they range, from all over the state to other New England areas. I'm not alarmed at that number. That number is usually pretty steady at that piece. So we're good to go there on that. Kylie talked about the SCC. I have some personnel pieces in non-public, and I will let the board know after discussing with the superintendent, and I'll send out an alert to the parents tomorrow, but we will not be running the mock schedule. The open house parent night that takes place, I think it's the 21st. Yeah, that's one of your school board meeting night, but I am going to cancel that. But I'll send out a notice to the parents, and if they do need to come in and see their son's or daughter's schedule, that the councils are available for them at that time. Other than the non-public, Madam Chair, unless you have questions for me, we did have a great opening.
Janice.
Do we need to have a motion and a vote on the digital portfolio
No.
requirement?
No, that's just informative. Yep. Just
Is
informative.
that 192 a trend? Is the 8th grade bigger than the senior class? Are we trending up?
No, it's a bubble in that grade. All the rest of the SAU grades, even K8, are around the 150, even the 140s down in K1, which is expected. So this is unexpected.
I'd like to do a shout out to Alex Ray. He graciously gave us his grill that we use. Freshman orientation was wonderful. And then the first day, you guys provided a cookout for the entire school. Kids blended in quite well. And they seem to find their way around with no issues. Class sizes are fine. I will share them with you at the next subcommittee meeting. Again, I'm letting the dust settle for the kids moving around. We did keep the same policy as I had when Randy came last time, allowing the students to come and go if they had earned time, and then a fourth period class. We'll keep that going. That seemed to work well. Kylie will talk about the dress code, and I will tell you about my life with the cell phones and how well they're going, and under discussion items. But unless anybody has any questions for me? Great.
Okay,
Thank
great,
you, Madam
thank
Chair.
you. Discussion items, COVID update.
So I'll review that with you a little bit. Right now, you have your return to school plan approved. Just a reminder of what we've kind of talked about through the past few months. In June, we approved the plan coming into this year, and basically saying we would follow the Department of Health guidelines. You talked about requirement versus recommended, and you were clear with me that it would be a board decision if you want to move from recommended to required. When we talked last month, it was optional when the kids were coming back to school. Cases were much lower. They ticked up, obviously. So we moved to a recommendation to throw on a mask if you're within. First, it was 6 feet. We talked a little bit in-house, talked with DHHS. The recommendation, we aligned it more with the American Academy of Pediatrics and the Department of Health after a discussion with them to reflect the 3 feet. 3-foot rule. I guess I'm so used to the 6 foot from last year too. We really were 6 feet most of the time last year till the end of the year. I would say with that, after making the recommendation, I would say increased staffing they've worn masks, and then the kids about 20 to 30%. So the kids that are choosing to wear masks is pretty low. As far as distancing in the classroom, we're at least 3 feet in every classroom, if not more, encouraging outdoor classrooms when they can. So that's something that we really took advantage of last year, and I would like to it's just a best practice in general to get outside and as much as possible when it's nice out. The masks are not recommended outside in any case, so that is right from the Department of Health as well. So you won't see, there's no signs around campus. As far as the COVID dashboard, some of the matrix from the Department of Health, when determining whether or not to move from optional to recommended or to targeted, they had this other piece of targeted and recommend by class. So it's more for the elementary school. If there was if there were a couple kids in a classroom, then maybe you would have that recommend masks. It depends, because I have some districts that are requiring, some that are recommending. So I have to just make broad statements in general to target some of the masking for a couple of weeks, for a month, whatever it may be, and then review again. So we have looked at, when we've talked with Dr. Chan and Department of Health, we've gone through our own data, because remember we were looking at our local data, because every community, every county at this point is substantial. So looking at our case counts, looking at vaccination rates is one of the pieces. And as far as SAU 48, our towns are all over the place as far as vaccination rates. I think we're from 30% to 70% vaccinated of eligible folks. And then you can even drill down to 12 to 19-year-olds and see how many are vaccinated in that population as well. We have a couple towns that are significantly low. Some that are, for instance, Holderness is at 100%, which I find interesting, because I don't think that is probably not accurate either. So I'm trying to look at multiple data points. It's a little different this year than last year. It was an emergency order. You know, the governor put in a mask mandate as well, so there's a little more backing from that end. So right now we did move the mask recommendation in place. I would say more of our under 12 population, there's a significant increase of mask wearing for that population. Then it kind of drifts off. Middle school, high school is choosing not to. Remember, I cannot ask if kids are vaccinated or not. So that is another piece. I did speak to the local health network to see if we would do another vaccination clinic if there were boosters. But with the availability of vaccinations, they're free in any pharmacy, that they just suggested it's available, so just go out and get it. So I was hoping we could, sometimes when we have it centralized, we had a lot of participation with that piece. So, but when we did our vaccination clinic last spring with the staff, we were over 90% of folks that got vaccinated within our SAU, so that was a good number. For the kids, I'm not sure, just because they could have been vaccinated outside of the, on their own time, and then some with us as well, depending on what the parent wanted. I have received all kinds of feedback for the high school piece, so Bruce is not. You have not received any feedback, but I would say I probably received a handful of emails on both sides of the issue. I've been informed of different groups that may be getting together to come out with a message on either side as well. So it's just something you should be aware of on that piece. I don't have any direct correspondence for you tonight. It's more phone calls and then emails of just, it's usually when I send out a press release or when I change the guidance and amend that a little bit. So that's just an update on that. As far as the screening and the testing universally, that's the SAS that you were hearing about a little bit, as far as monitoring the prevalence of COVID in our schools. That's something that we've been looking at a little bit, but we haven't really pursued. So if that's something the board wants me to pursue and look at, I can certainly do so to see if it's feasible, if that's the choice of the board. So right now, that's where we're at. Are there any questions or any? We have no cases as of today. So that's the other. We did have a few cases right before school started, actually. So those have closed out at this point.
Barbara.
I'm reading all of this material and watching what's happening in our district and in our SAU. I saw that we had cut back from the 6 feet to the 3 feet, and to me that feels like we're looking backwards. And I know this is the way it's been going for a while, but when we set out and started at a 6-foot distance, that we had to wear the masks, then we cut it back to 3 feet. It says, am I reading this backwards? It's like we can be closer. and use a mask. I think we should be wearing masks from 6 feet to be better. So I'm looking at this, I think, backwards.
So I think the 3-foot rule is based on the newest guidance. So
Right.
we started with 6, and that could be my fault too, starting more cautiously. And then looking at the guidance, after looking at the teams, that is what the guidance is 3 feet. So we adjusted it to reflect the guidance. I
And that's-
think that's the whole piece as far as, it's easiest for me to follow whatever guidance is in front of us. But if you want to recommend or require, I think that's up to the board.
I've been following what you've written, I'm not picking on that, I'm just saying, when we start out and say you have to wear a mask if you're within 6 feet, and we're doing, there are increased cases, now today there are none, there are increased cases, so we're coming back to 3 feet, it feels like we're doing better, which we are.
Right.
So, this is just wondering why we went from 6 to 3.
If I were to write that press release again, after the feedback I got, I would have just put, we're amending the guidance to reflect the American Academy of Pediatrics. It was just the same template, and it was confusing to some folks, so it was not because of increased, it was because of the American Academy of Pediatrics.
Any other questions? Okay, dress code policy amendment.
Kylie?
So we'd like to allow the students to wear athletic wear, shorts that, unlike skirts, they're completely covering their legs. And we'd like to do like a 3.5-inch inseam, just for the availability of actually what students can buy nowadays, and, just making it so that they can be more comfortable wearing stuff like that.
Okay.
So, can you say that one more time?
Sure. So, we'd like the students to be able to wear athletic wear, like shorts that are like 3.5 inches, maybe inseam. So they wouldn't be, they'd be above the knee. They wouldn't be within the 4 inches that we currently have in the policy. But they're more stuff that kids wear to gym class and, wear to work out in and to team sports and all that kind of stuff. But we'd like them to be able to actually wear them in the building during the school day as well, and not just for sports.
So, yes, so that part was passed already. The other piece that we're adding in is just regular shorts.
Correct.
So like if they're jean shorts and they're fine, then that's fine. I think we just have to be a little bit more flexible with the dress code, given what's out there as well. So it seems to work. Kids have been good with.
Yeah,
responding
Kylie's
to
out
it.
there every morning with me, and we're monitoring.
So it's not just sports shorts, it's other shorts,
Other
the
shorts,
same
too.
length for both genders, for whoever wears shorts.
So we're looking for a motion for that.
So a motion to call it shorts, as opposed to what we called it with our original policy of athletic
Athletics,
shorts.
right.
Made by Tim, seconded by Phil. All those in favor? Aye. Opposed? Abstaining?
Thank you very much. Okay, cell phones. I had the wonderful privilege of meeting with all the classes during the week. They really think I'm losing it, but we talked about the cell phones, and I did survey the staff, which was great. And they came back extremely positive. They definitely did not want to see cell phones in the classroom. There are times that some of the teachers will need to use the cell phone, and that's teacher controlled if they're taking a picture or something with the curriculum on that piece. But where we gave the kids some huge leeway was in the hallways, in the cafeteria, in their study halls. And I gotta be honest, they've been decent. I mean, they're not getting used to it. When I walk around, they still try to hide. And I say, keep in mind, we okayed this, and it takes some time for both of us to get used to it. But it's done well. The kids, they cannot take calls or make calls that will land them in cell phone jail. And they've been very, very good with it. So hopefully we'll continue along the path, and we'll be able to work together as we move forward. But it has worked out. Thank you.
Okay. And we had already done that, so we don't need to...
Yes, we did, but I just wanted to report out
Okay.
on it The survey coming back from the teachers was extremely, they were in full agreement too. Pretty much 75% of them agreed that they should have in the hallways and in the study halls too.
Okay.
But not making calls or receiving calls.
Okay.
Texting silent. In the learning commons too, they can use.
And the preliminary data on that is that they're using them less than when they weren't allowed to.
Yeah, so I don't know who they were calling before. Wasn't me.
Thanks for the update.
Thank you.
Other business?
I don't have anything else.
Okay, board member concerns, comments, any thoughts? No, everybody's good? Okay, privilege of the floor, second time. Anyone have anything else to contribute?
I just have a question.
Sure, Heather, come on up.
I'm just interested in where the information from Dr. Chan about the 3 feet versus the 6 feet. Because I know as far as close contacts go, and I know that you don't have to send people home if they're close contacts, but if face masks are consistently and correctly used, this says, then a close contact would include persons sitting within 3 feet. But the last time I had heard, Dr. Chan was recommending if you're not going to be masked, you should be at least 6 feet apart.
Right, I can get that resource for you if you would like. I don't have it right with me, and I hope I'm not misspeaking, but I will certainly look at that again and see that. Okay?
Yes, thank you.
It's hard to remember 6 feet, 3 feet,
It
15
is.
minutes, 10 minutes, 20, so
It
we're
is.
trying to make it, we even took some of it off our press releases because I think I was confusing parents more than helping them. So I will check that.
Okay, thank you.
Thanks, Heather. Motion to go into non-public for personnel and negotiation. I will do, okay, great. Seconded by,
I'll second.
and I'll just do the nods. Barbara, Maureen.
Yes.
Okay. Excellent. Thanks,
Yes.
everyone.